Welcome back to the Manifesting Health series. I'm Bordelon. I'm your host for this discussion. Today, we're excited to have Victor Huwe join us for this episode, Men in Cancer, the latest insights. Victor is a board-certified nurse practitioner providing compassion and expert care for men who have been treated for cancer with specialized training in family health and sexual medicine. Victor's passion is to help men meet their goals of overall health and sexual wellness. Welcome, Victor.
Thank you. Happy to be here today.
Excellent. Thank you for joining us. We're really excited to hear what you have to say about cancers, specifically among men. So as we get
Mhm.
started, can you share with us a little bit about your history and how did you end up in the space that you're at with this passion area?
Sure. So I come from primary care and then went into men's sexual medicine. And I've been in this field now for 3 years. It's something I sort of just fell into. I didn't know there was a specialty just for sexual health, but it's a very important topic, and it's something a lot of people don't realize that. There's resources out there for treatment for after cancer care, such as for erectile dysfunction, low testosterone, Peyronie's disease, many things that affect men. And, it's we help men continue their quality of life, basically.
Excellent. Thank you so much. So let's, as we get, continue on our conversation, I want to talk a little bit about where we are in the state of cancer in the male population. So just in general, some of the main trends that we're seeing and the main areas that we're seeing for risk factors for men.
Mhm. Sure. So the most common cancers affecting men include prostate cancer, testicular, lung, colorectal, and skin cancers. Prostate cancer in particular is impacts about 1.3 million men worldwide. In the United States,
Wow.
experts anticipate 290,000 new cases by the end of 2025. We know that there's several factors that contribute to the increased risk of cancers, including smoking, and also now for a young population of men, vaping.
Interesting.
Age, we're living longer, and nearly two-thirds of cancers and deaths occur in men age 65 and older. Also, lifestyle, diet, physical activity, alcohol consumption, and environmental exposures. But what is really key is prevention and early screening and detection for better survival rates. Public health initiatives need to continue to focus on education, lifestyle changes, and screening programs, while research plays a crucial role in the type of treatments that we can offer these patients. Right now, the state of cancer among young men, we can make lifestyle modifications, through diet, nutrition, physical activity, tobacco and alcohol use, sun exposure. And when I'm talking about smoking, smoking is a primary factor for lung cancer, including secondary exposure to smoke. We have strict regulations in place now on tobacco advertising, packaging, and sales. Public smoking bans and graphic warning labels on cigarette packaging have all contributed to the decline. Smoking cessation programs are big now. I know in my institution, this is something we offer everybody if we find out they're current smokers. And these are aimed at helping people quit smoking, who have become these have become widely available. These include access to smoking cessation medications, counseling, and support groups.
How
Anti-smoking campaign.
receptive, yeah, if
Mhm,
I can jump in here, how you're talking about smoking cessation, and
mhm,
I want to continue that stream of thought here.
mhm.
How receptive are your patients and patients in the cancer communities to these cessation techniques, whether it be the oral, whether it be gums or whatever else it might be, or the stop smoking type other behavior modification type practices? How receptive are your patients to that, and then how sustainable is that for these patients?
I think, well, in my personal practice, if I find out someone is a current smoker, the question is, are you ready to quit?
Mm,
Uh, Uh,
Good point.
and some men say yes right away. Others need a little bit more coaching. The biggest one where I work is, well, your smoking affects your erectile function. And that's a big deal to a lot of men.
Right.
And then they'll ask about, well, what's available to me as for options for smoking cessation. And then in my institution, we actually have nurse practitioners that specialize in that, so I'm able to refer them over to that practice.
That's interesting that, and
Yeah,
it continues, it gives that more of the holistic approach. We've had some of our other
mhm.
recordings and conversations with some of the experts talking about preventative care in men and so forth. And the number one step is getting them in the office. And then the
Sure. Yeah.
next big step is actually having them communicate. And so that's the big challenge for a lot of the men in your clinic and in your space. How do you how do you first interact with men? Is it an outpatient clinic that you can actually start seeing men? Are you referred, or people refer to you? And then how do you get them to open up? Because that's a big challenge we have.
Mhm.
And as you mentioned, there's so many things that affect the body in a way, in a negative way, that can lead to cancers:
Mhm.
smoking, other risk behaviors, excessive drinking, poor diet, no exercise. All of that plays into a rising number of cases of colorectal cancers and so forth.
Sure.
How do you get your patients to open up to even start the dialogue?
Well, in my practice, these patients have already been diagnosed, have a cancer diagnosis, and then they're referred to our clinic. We're part of a big urology group, and then sexual medicine is a specialty within the urology group. So men that have had can't treatments already for their prostate, bladder, uh, and then or men from colorectal services that have surgeries and radiation for their colorectal cancers. Anything dealing with the pelvic area that affects erectile dysfunction, then they're referred to us. So then that's when we do a pretty much head to toe assessment because yes, the primary reason they may have these issues with their erectile function or sexual health is due to the treatments for their cancers. But then there's also other comorbidities that play into that, such as, hypertension. Are you a smoker? Diabetes, even sleep apnea.
It's alarming some of the rates that we've seen in the trends, not only in the risk behavior category, but the younger and younger population, specifically in men, of these different, sort of challenges, cancers and
Mhm.
hypertension and obesity rates and so forth. So it's really alarming to see this trend in this patient population and where we're going in this. And so I'm glad that we're making some strides in the science, but also the preventative side as well. So I want to go back to your discussion with the clinic that specifically that where your patients are that you manage.
Mhm.
These are post-diagnosis cancer patients. You see a lot of those patients, specifically those that come to you for sexual health and wellness, but also post-treatment continuity of care for them in their goal for sexual health and wellness. How so once they've been treated, once your
Mhm.
patients are treated, once they've had their diagnoses,
Mhm.
that's already a difficult conversation. You're in the treatment phase, you pass the treatment phase, and they're coming to you with something very sensitive. How do you help them understand this is part of the recovery process in some cases, or the ongoing care, and what can you provide them in the clinic?
Yeah, that's a great question because a lot of times, sexual health is the last thing on some of these guys' mind. They've just been hit with a cancer diagnosis. They've had major surgery all within 3 months. Uh, and now they have a referral to our office. And I would say half of those men, the question is, I don't know why I'm here. And well, then we
That's
have to,
interesting for them to have that first sort of wall that's been formed.
yeah, well, I think, it's just the anxiety and the stress that they're
Right.
dealing with. And it's not only just them, it's also their partners
Sure.
with this cancer diagnosis. And they're just trying to figure out, how to stay alive and cure the cancer.
Right.
They never thought about sexual health, and then it's up to us to educate them on how important sexual health is as well. I always remind these guys, you know, if your cancer right now is treatable, and there's going to be a time where you're feeling good, and if you go with uh, a certain amount of time too long with lack of having a good erection, then when you're feeling good and then you're ready to have sex again, it may be more difficult for you. The treatments that we can offer you now won't be as successful as if you postponed treatment.
Right. I'm glad you're having those honest conversations with your
Mhm,
patient and their partners and families as well,
mhm,
because it's so very important. One of the things we're trying to do with this series and other sort of conversations within the organization and other spaces is to continue the conversation about men's health and how men's health
yeah,
matter in a way that's really important for the family and for others around
mhm,
you. And so this is another one of those very sensitive conversations for many. But the more we have this conversation, it's impactful, but at the same time, it gives a voice to a concern that's been pushed to the back because of a stigma, because of the societal
sure.
challenges and so forth. So I'm glad you're having a conversation with your patients in a very honest and transparent way. So thank you again, and thank you for
Yeah.
sharing a lot of your expertise with us. As we're
Mhm,
closing out, can you give us some takeaways for our
mhm.
listeners and our viewers? What are some of the things that you want them to walk away from?
I want them more to have a. I think what I want to walk away, what I want people to walk away with is, especially for healthcare workers, is there's resources out there to help you with those uncomfortable conversations. I think back to the question you asked me earlier, why do people come to me? And I think, and when patients say to me, "I don't know why I'm here today," I think it's because the other providers don't know how to have those conversations. They're not comfortable
Mm,
talking about sex.
right.
So I think getting involved in organizations such as yours and having these webinars, the American Association of Men in Nursing. There's also the Sexual Medicine Society of North America has great resources for providers. Um, and some of the cancers that we deal with, such as like anal cancers, anything related to HPV related cancers. There's organizations like the Annual Health Workforce Conference that providers can go to, and you can learn the terminology that LGBT patients like to use, because a lot of these type of cancers affect them. So I think we need to get the word out that there are resources for our colleagues so they can be more comfortable having these conversations. And as for our patients, I think making it a safe space for them, making it very comfortable to talk, because I think especially men, we're sometimes a little bit stoic. We like to just stay silent about all our problems and stuff like that, and we don't want to
Right.
talk about our health. Uh, and it's funny, once you get men comfortable, boy, do they open up. And it's easier then to come up with treatment plans and help them and their partners meet realistic goals.
I'm so glad you mentioned that as well. We've had some of our experts within the organization, but elsewhere within the healthcare spaces that say the very same thing you just said. Once
Yeah.
you create that safe space for them to open up, they'll open up and they'll share a lot of things. And many times they've hold on to for a long, long time. So I'm really
Oh
glad that you
yeah.
mentioned that.
Yeah.
So thank you
Yeah.
again for your time. I really appreciate your expertise, Victor. I really appreciate this very transparent conversation on a very important topic. And thank you all for listening to us today. See you next time.